maybe Elaine, I could turn to you for that. I know that elenbecestat and BAN 2401 have both been chosen by the Alzheimer's Clinical Trial Consortium, funded by the NIA, to be tested in that consortium. Could you tell us a little bit about that decision process and how you see that going ahead?
Yes, I mean, Richard sort of touched on this in the session we saw yesterday afternoon, talking about all the BACE inhibitors in testing. To some degree, elenbecestat is sort of the last man standing, and a handful of them have been shown to either have been stopped for futility or to be actually cause worsening of cognition, so cognitive decline, and one showing hepatic toxicity. So elenbecestat, still we have no negatives, we have some positives. So the phase 2 study showing, they've all shown robust target engagement. They all robustly reduce the production of new A-beta 42. Elenbecestat in the phase 2 study showed robust target engagement, reduction of amyloid positivity on amyloid PET, and also some clinical benefit with respect to a modest reduction of decline of 35% at 12 months and 30% at 18 months. So there's still some positives. There's no negatives for cognition. And in the phase 3 study, at least the first DSMB, the Data Safety Monitoring Board meeting, showing no concern about safety. Let me talk a little bit about the A3 and A45 studies. So the A45 study is a planned study for secondary prevention of Alzheimer's disease in preclinical. So these are people who are cognitively normal, have the amyloid PET signal of having amyloid in their brain. And it's a sequential strategy of first removing amyloid using the monoclonal antibody BAN 2401, and then following that, reducing the production of new amyloid using elenbecestat. The A3 study even shoots a little earlier. So it's the same strategy, but now in preclinical Alzheimer's disease. That is, people who are cognitively normal, who have a little bit of amyloid in their brain, but don't meet that threshold for saying this is an amyloid positive scan. And so that's the strategy, but a little bit to return to Richard's, I'd say, robust advocacy for amyloid therapies. I think I'm going to play a little bit of devil's advocate. There have been a lot of strategies for removing or reducing amyloid. Monoclonal antibodies, a large number of them, gamma secretase inhibitors, BACE inhibitors, amyloid aggregation prevention strategies. And still, they have not borne the fruit we would have liked them to have seen. But I think the A3 and A45 studies will give a definitive answer to whether anti-amyloid therapies are the way to go for Alzheimer's disease.
Great, all right, thank you. And both of these drugs are being used in both A3 and A45,
yes.
Is that correct?
Yes, and in this sequential strategy.